Hi, Eileen Bayer, the PM here. Welcome to a new installment in our mini mental health series. And as you can see from the title of this, What is Agoraphobia? That is going to be what we are covering for our new installment. Before we begin, let me just give you a small friendly reminder to watch the full video because there's going to be 3 keywords in the video that if you put the 3 keywords in the video in along with your genuine comment about the video in the comment section when you're done, you will be eligible for my free merch giveaway when I reach 2,000 subscribers. And who knows, you may get a pillow. It might be a t-shirt. It could be a hoodie. You don't know what I'm going to choose. So put your 3 keywords in at the end of the video to be eligible. So let's get started. What is agoraphobia? Do you know what agoraphobia? Have you ever seen anybody with agoraphobia? I'm sure you've heard of it. I've seen it in the movies. Well, let's go over what agoraphobia is. Keyword: agoraphobia. Agoraphobia is a type of anxiety disorder in which you fear and avoid places or situations that might cause you to panic and make you feel trapped, helpless, or embarrassed. You fear an actual or an anticipated situation, such as using public transportation, being in open or enclosed spaces, standing in line, or being in a crowd. The anxiety is caused by fear that there's no way to escape or to get help if the anxiety intensifies. Most people who have agoraphobia develop it after having one or more panic attacks, causing them to worry about having another attack and avoid the places where it may happen again. People with agoraphobia often have a hard time feeling safe in any public place, especially where crowds gather. You may feel that you need a companion, such as a relative or a friend, to go with you to these public places. The fear can be so overwhelming that you may feel unable to leave your home. Agoraphobia treatment can be challenging though, because it usually means confronting the fears. But with psychotherapy and medications, you can escape the trap of agoraphobia and live a more enjoyable life. Now, what are the symptoms of agoraphobia, you ask? Well, some of the symptoms of agoraphobia are leaving home alone, crowds or waiting in line, enclosed spaces such as movie theaters, elevators, or small stores. Open spaces such as parking lots, bridges, or malls. Using public transportation such as a bus, plane, or train. These situations cause anxiety because you fear you won't be able to escape or find help if you start to feel panic or have a disabling or embarrassing symptom. Fear or anxiety almost always results from exposure to the situation. Your fear or anxiety is out of proportion to the actual danger of the situation. You avoid the situation, you need a companion to go with you, or you endure the situation but you're extremely distressed. You experience significant distress or problems with social situations, work, or other areas in your life because of the fear, anxiety, or avoidance. Your phobia and avoidance usually last 6 months, keyword 6 months or longer. Panic disorder and agoraphobia. Well, what is panic disorder and agoraphobia? Well, some people have a panic disorder in addition to agoraphobia. Panic disorder is a type of anxiety disorder in which you experience sudden attacks of extreme fear that reach a peak within a few minutes and trigger intense physical symptoms better known as panic attacks. You might think that you're totally losing control, having a heart attack, or even dying. Fear of another panic attack can lead to avoiding similar circumstances or the place where it occurred in an attempt to prevent future panic attacks. Signs and symptoms of a panic attack can include rapid heartbeat, trouble breathing or feeling or choking, chest pain or pressure, lightheadedness or dizziness, feeling shaky, numb or tingling, excessive sweating, sudden flushing or chills, upset stomach or diarrhea, feeling a loss of control or fear of dying. Well, when should you see a doctor if you have agoraphobia? Agoraphobia can severely limit your ability to socialize, work, attend important events, and even manage the details of daily life, such as running errands. Don't let agoraphobia make your world smaller. Call your doctor if you have signs or symptoms listed above. That is very important. If you know someone that has agoraphobia, it's important that they do get the medical help, be their support, be understanding of what they're going through. Don't make fun of them. Don't laugh, even in a joking manner. It could be your wife, your husband, a friend. It doesn't matter because they may know you're joking, but inside it tears them apart. They don't like this fear. They don't know how to control it. They don't know how to handle it and to overcome it. But it can be overcome. What are the causes of agoraphobia? Do you know what the causes are? Let's go over it and find out. Biology, which is including health conditions and genetics, temperament, environmental stress, and learning experiences may play a role of the development of agoraphobia. The risk factors involved in agoraphobia are having panic disorder or other phobias, responding to panic attacks with excessive fear and avoidance, experiencing stressful life events such as abuse, the death of a parent, or being attacked, having an anxious or nervous temperament, having a blood relative with agoraphobia. Are there any complications with agoraphobia? Any type of mental illness has their complications as well as the risk factors. So let's go over and see what we can find out about what are the complications of this. Agoraphobia can greatly limit your life's activities. If your agoraphobia is severe, you may not even be able to leave your home. Without treatment, some people become, keyword, housebound for years. You may not be able to visit with family and friends, go to school or work, run errands, or take part in other normal daily activities. You may become dependent on others for help. Agoraphobia can also lead or be associated with depression, alcohol or drug abuse, other mental disorders, including other anxiety disorders or personality disorders. Is there a way to prevent agoraphobia? There is no sure way to prevent it. However, anxiety tends to increase the more you avoid situations that you fear. If you start to have mild fears about going places that are safe, try to practice going to these places over and over again before your fear becomes overwhelming. If this is too hard for you to do on your own, Ask a family member or friend to go with you or seek professional help. If you experience anxiety going places or having panic attacks, get treatment as soon as possible. I can't reiterate that enough. That treatment has to be there as soon as you notice this. The earliest the treatment, the better. Um, get help early to keep symptoms from getting worse. Anxiety, like many other mental health conditions, can be harder to treat if you wait. So that's what agoraphobia is, and it gives you a little bit more insight on it. Now, I'm sure a lot of people don't understand. We hear about claustrophobia. Well, that's actually a form of agoraphobia because you feel confined and trapped in a small space. And a lot of people suffer from that type of agoraphobia. Um, there's different types and there's different triggers. We'll go over the triggers. Some might be a dream you had. Some, like I said, could have been something you experienced once before and it caused a panic attack. So if you think you may have agoraphobia or you know somebody that may have agoraphobia, talk to them. Work with them, support them, encourage them, uplift them, and try to help them to get the help that's needed so they can live a more enjoyable life. Imagine yourself in their shoes. Walk a mile in their shoes to see what it's like. After you learn this, try to picture yourself in their situation. And I can guarantee you're not going to like what you see. So find ways to be helpful and encouraging and inspiring. Do what you can to lift up instead of tear down. Remember, something that may be a joke or kidding to you isn't funny to somebody that's suffering. They may know deep in their heart that you're joking or kidding, but it's gonna bother them and they're not gonna say anything about it. They don't like what they have. Help them through it. Talk to them about finding a way to help them alleviate that part of the anxiety so it's not there for them no more. Remember, always to see with your heart and not your eyes. Think with your heart, not up here. Let this control you. When you see with your heart, you can see what a person's going through on the inside. You can feel their pain. You can feel their fears. You can feel all their emotions. You can actually understand what they're going through. And then you won't feel so good about joking or kidding or even picking on somebody. So always remember to see with your heart and not your eyes, because what the eyes see isn't what matters. What truly counts is invisible to the eyes, and only the heart can see it. And remember, until I see you again, you are important to me, and I love you for who you are, the way you are. So until I see you again, I love you. Bye, everyone.